Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about newborn screening tests. Newborn screening tests are done to identify babies at risk and those in need of more testing and/or treatment after birth. Tests are done in the hospital before baby goes home. In some states, a baby is screened again in 1 to 2 weeks. For most tests, a few drops of blood from a heel stick is all that is needed. 1 or 2 days after birth, baby will have some tests called newborn screening tests. A baby can be born with a health problem but not show any signs of it at birth. These tests check baby for various health conditions at birth. Testing includes blood, hearing, and heart screening. Tests done on your baby depend on where you live. Some states test for as many as 35 disorders, while other states only test for 4. You can find out which tests are given in your area by checking with your hospital. You can also ask baby's doctors. There are private companies that can do more screening if you wish. Every baby is assessed with the APGAR score immediately after birth. This test is used to assess your newborn's overall condition. The test is conducted at 1 and 5 minutes after birth. A score of 0, 1, or 2 is possible in 5 areas, including heart rate, color, muscle tone, respiratory effort, and reflex irritability. Scores from the 5 criteria are added together for a maximum total of 10. An average score for most babies is 7 to 9. The APGAR score determines baby's current health following delivery, but is not used to predict future health. In all 50 states, newborns are tested for phenylketonuria, PKU. Left untreated, PKU can cause brain damage and mental retardation. If found early, the problem can be dealt with by feeding baby special formula. A child will have to follow a special diet, maybe for life. With the Coombs test, blood is taken from the umbilical cord for testing if your blood is Rh negative. It checks for Rh antibodies in baby. The reflex assessment tests for several reflexes in baby. If a particular reflex is not observed, further evaluation will be done. Various characteristics of baby are assigned to evaluate her neuromuscular and physical maturity. Each characteristic is assigned a score, and the sum indicates baby's maturity. The Brazelton Neonatal Behavioral Assessment Scale covers a broad range of newborn behavior. It provides information about how a newborn responds to her environment. It's usually used when a problem is suspected, but some hospitals test all babies. Another test screens for hearing problems. A small earphone is placed in baby's ears, and a computer checks how she responds to sound. A pulse oximeter machine is used to screen baby for congenital heart defects. It checks the amount of oxygen in baby's blood. Baby's blood is also tested for particular problems such as anemia, congenital hypothyroidism, galactosemia, biotinidase deficiency, and blood glucose levels. Baby may also be screened for sickle cell disease, cystic fibrosis, amino acid disorders, hemoglobin disorders, and other problems. Results often indicate whether baby needs further evaluation or special treatment. Newborn screening tests are important for your baby's health. Talk to your doctor about newborn screening if your baby was not born in the hospital. These tests should be done on baby as soon as possible. If you'd like to read about baby, check out our book, Your Baby's First Year, Week by Week. We cover many subjects dealing with baby in a weekly format. Each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It lists topics about baby covered in our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and other important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.